Hello, I'm Todd Hanley, Director of Marketing and Communications here at MIHS, welcoming you to this edition of The Pulse. Today, I'm going to sit down with Dr. Johnson Egbakwu as we talk about the Women's Refugee Clinic and all the great work she's been doing around that. Dr. Johnson Egbakwu, thank you for joining me here today.
Thank you for having me.
Of course. So you started the clinic back in 2008. Tell me a little bit about it and what are you doing there?
Sure. So back at that time, this did not exist within the OBGYN department, but Dr. Dean Coonrod, the chair of the department, had a need because they were struggling with the increasing refugee communities that have been entering the valley, and they witness a lot of cultural barriers and challenges in patient care and outcomes specific to the Somali community. When I was job hunting across the country, this opportunity was just exactly what I needed to take my research to the next level, to basically create a best practice model for refugee populations. And so I was granted the amazing opportunity to do just that in 2008. And the initial populations we served were just primarily Somali and Burundian because it reflected the staff that we had at the time. But over the past 10 years, we have grown tremendously to now serve women from over 53 countries across Sub-Saharan Africa, Southeast Asia, and the Middle East. We're the first clinic of its kind in the state of Arizona, and we've been nationally recognized by AHRQ, the Agency for Healthcare Research and Quality, as a best practice model for refugee women's health services. And what makes us distinct are the nature of services that we provide in really, it encompasses holistic approaches to engaging refugee new arrivals in terms of building trust, meeting the language needs, having a team of cultural health navigators that support intensive care coordination and case management to make sure that we can ensure close follow-up, important linkages to ancillary services within our hospital, but also ensuring longitudinal care. So we provide bread and butter women's health services, whether it's prenatal care, preventive health, in terms of cervical cancer screening, mammography screening, as well as health education. As you can imagine, many women are coming forcibly displaced due to war and conflict. And they may have had very limited opportunities for formal education. So health literacy is a challenge. And so we have to utilize innovative strategies to enhance health literacy and be able to build trust and serve these communities in such a way that we can optimize quality care as well as optimize reproductive health outcomes for these women. I think, and I say this all the time, one of the critical aspects of our success is the fact that we have cultural health navigators who are unique to our model of a patient-centered care approach, where these are women who speak approximately 13 languages across the various spectrums of regions where our patients derive. They have that shared cultural identity, but they're also multilingual. They're certified medical interpreters, but they themselves speak anywhere from 2 to 6 languages each. And they also are leaders in their own community, highly respected and trusted leaders who are able to navigate care and influence not only within our health system in the outpatient and inpatient settings, but also out in the communities. They are the bedrock of what makes our services so unique, in that we're able to minimize gaps in care, minimize no-show rates, and really optimize those critical linkages to comprehensive services, both outpatient and inpatient, through these relationships with our navigators.
That's actually grown now. As I understand it, there's a pediatric refugee clinic and an immigrant clinic at the Arizona Children's Center.
Absolutely.
How did that come to be?
Sure. So over the 10 years that we've been serving this population, and we have delivered over 1,400 newborns. And those newborn babies are plugged into our pediatrics clinic. But of course, as you know, with refugee families, they have existing children who have also survived and escaped war and conflict. And so as a result, over the last 5-6 years, the Pediatrics Refugee Clinic has emerged as another important and formidable force of clinical care and services serving children. And so MIHS, the very mission of this hospital as the only safety net hospital in the state of Arizona, is to serve vulnerable and underserved populations, and the refugee community falls right into the very mission of our hospital. And so we have been able to achieve tremendous growth through the support that we've received through our senior administration and our OBGYN and pediatrics department to be able to serve comprehensively over close to 6,000 refugee women since we started, and now in the pediatrics clinic, I know there are definitely upwards of more than 1,000, 1,200 children that they have served, and it continues to grow. I think we are garnering great momentum, and we have extraordinary support by the senior administration here at MIHS and my chair, Dr. Dean Coonrod, to really look at how we can transform care beyond just women and children, encompass the entire family. And so we're looking at how we can create a center of excellence for refugee health care, encompassing men, women, and children in the family units as so critical to optimizing health care and health outcomes and holistic approaches to care.
Dr. Johnson-Ekbaku, thank you for joining me here today.
Thank you.
It is inspiring. So I
Thank
appreciate
you.
all of your hard work and all of your passion and all of your vision.
Thank you. It's a humble recognition when you can see realize this is your life's work. I feel as though this has been my calling to serve in this way, and I'm just so humbled to have the opportunity to make an impact in this particular community, and to be able to have the support here at MIHS has been extraordinary. So it's an honor for me. Thank you.
And we're lucky to have it.
Thank you
Awesome.
so much.
Thank you very much for joining me.
Thank you. Thank you.
Yeah.